Hi, my name is Savannah DeHart, and I'll be discussing different types of pregnancies, stillbirths, and other losses. First up, we have molar pregnancy. Molar pregnancy is also called gestational trophoblastic disease and hydradatiform mole. Molar pregnancies happen when the cells that are supposed to develop into the placenta instead develop into a tumor made of trophoblastic or placental cells. The growth must be removed so that it doesn't spread. According to our bodies, ourselves, the chances of this happening are very low, about 1 in every 1,000 to 1,200 pregnancies. Partial molar pregnancies can also happen. This is where there is some fetal development along with abnormal placental growth. Signs and symptoms include high blood pressure, first trimester vaginal bleeding, and a uterus too large for the gestational age. A D&C, or a dilation and curettage, is used to treat molar pregnancies. D&C is used to remove abnormal tissues, and in rare cases, chemotherapy is used for treatment. Multiple gestation pregnancy loss. When there are 2 or more fetuses and 1 or more dies. This type of pregnancy is riskier than single fetus pregnancies for both the mother and the babies. This is very common with women over 30 or using infertility treatments. This is referred to as the vanishing twin syndrome. A sign could be vaginal spotting during the first few months of pregnancies. In some situations, the mother or all fetuses' lives may be at risk so selective termination is an option. Selective termination is all based on opinion. There really is no right answer. Stillbirth. Stillbirth is the loss after 20 weeks gestation. Stillbirths occur in about 1 out of 160 pregnancies, which this ratio varies with different age groups, of course. For example, women under 15 and women over 40 have the highest rate of stillbirths. Some causes of stillbirths include genital abnormalities, placental problems leading to bleeding and fetal growth restriction, and preterm infection in a fetus that is too young to survive. Some other factors increasing the possibility of stillbirths for women under 15 and over 40 are multiple gestation pregnancies, smoking, obesity, and using drugs. Majority of fetal deaths are detected before labor. Typically, during a routine checkup, ultrasounds can determine officially if the baby is dead or not. There are a couple of options if the baby is detected as dead. These options include waiting for labor to naturally occur or inducing labor, because it might be a little easier to induce labor and get it all over with instead of waiting however long until natural labor occurs. Early infant death. When a baby dies during the first 28 days of life, it's also referred to as neonatal death. Some causes of early infant death can include impairments that may or may not have been detected, something that went wrong during labor, or there are some unknown causes. One big contributing death factor among infants is low birth weight. Babies who weigh less than 3.4 pounds are 100 times more likely to die within the first year. Coping with the loss. The loss of a pregnancy or baby can bring up many emotions such as confusion, relief, shame, anger, sorrow, fear, powerlessness, or even despair. Losing a child at any stage is very difficult. You may feel like there is a void in your life or even a sense of loneliness. Grief can cause feelings of tension between partners. The blame could start. One parent blames the other for something that they think went wrong, when really that is rarely the case. Even feeling like you were the one that did something wrong, so you might end up blaming yourself for the loss of your baby, but rarely it's your fault. Along with emotional responses, your body will be going through changes as well. It's important to go to follow-up visits with your healthcare provider to make sure that you are taking care of yourself. Some healthy ways to cope include creative artwork, writing, reading, or even trying to get pregnant again if possible. And I am referencing my women's health book, Our Body, Ourselves. Thank you.